get acquainted with your doctor, maybe to undergo some medical test to leave sperm. This all can be done through first visit during first 2-3 days. And if egg donor is involved, you already are not required to stay in Ukraine. You go home and you just come back before 1-2 weeks before a child delivery. But if you wish to visit your surrogate during pregnancy, of course, no problem. We can organize that. Lyudmyla, can the surrogate acquire legal custody of the child? Quite a popular scenario for movies, but I guess there is more to it in real life. Yeah, I saw several movies with that problem, but I can tell you that mostly these are foreign movies, not Ukrainian one, because Ukrainian legislation protects rights of intended parents. And it proved to be much more progressive than the legislation of other countries. From the very beginning, from the moment when embryo of intended parents is transferred into the uterus of surrogate, they obtain absolutely all parental rights of that. And surrogate, even if she changes her mind after child delivery, does not have any legal right to do that. This is from the very beginning the legal child of his intended parents, and no court will support surrogate if she tries to apply to court to get parental rights. So no issues about legal custody under the condition that there is no genetic connection between surrogate and a child. Could you please also explain here a little bit more about why Ukrainian women want to be surrogate mothers? Yeah, this is very often, frequently asked question, I would say so. The first issue is that, of course, on the level of psychological evaluation, we have to understand what is the motivation of the woman, because the motivation matters a lot. We can even stop working with her if we are not satisfied with what motivation she has. If it is just purely financial motivation, it will be very, very difficult, because it means that this decision is just because of some very sharp, very maybe dramatic financial issues, and it means additional stress in her life, and it means that she will be interested just in money. We should find, we have to explore some inner motivation of her heart, because this is a special gift which she gives to infertile couple. Of course, money matters, we do not hide that fact, but I want to tell you that if just money matters, we do not work with these women, and even if we just do some test, I mean, we go just out of doors and ask each woman if she will agree to carry a child for a certain amount of money. Not all of them will agree, I'm absolutely sure. So it means that not just financial issue matters here. Many of surrogates who come to us have infertile friends or infertile relatives, and they understand how difficult is this. So they experience that on her own, and they want to help because they are healthy, they are reproductive, and they can do something very precious in their life. Hello IRTSA, is it right if in future I will tell my baby that she was born by surrogate? What do you think? Thanks. Well, this is a very complicated question, I would say. This is a very deep psychological issue which should be solved individually. Well, let's say that we have couples who disclose the truth to their child or are planning to disclose. We have couples who are afraid if someone will disclose that and they want to keep that in secret, but still, as for psychological condition of a child, there are no maybe one general recommendation toward each child, because every parent better knows his or her child and knows if the child is mature enough, psychologically strong to hear the truth, and we just should think if the child needs that truth in general. If it's so important to tell him that he was not born by his intended mother, you know that the mother is the one who rises, not the one who delivers the child, and that's why maybe you should consult with a psychologist, and psychologists should evaluate your child before you tell them the truth, not to create psychological problems for the child. Whose names go on the birth certificate after the baby is born? Well, as I already told, this will be the name of infertile couple, the mother and father. Lyudmyla, are there any risks involved in becoming a surrogate mother? Oh, I think that this would be the question of Natalia. Какие есть риски для суррогатной матери? Чем они отличаются от рисков по обычной беременности?
Ну, риски всегда есть, потому что беременность может прерваться, замереть, могут быть преждевременные роды. Поэтому суррогатная мама чаще всего она здоровая женщина, и они очень хорошо вынашивают детей. Практика наша показывает, если это не одноплодная беременность, риски значительно ниже. Выше риски, когда мы получаем двойню. При программах IVF, когда мы переносим два эмбриона, риск двойни, получить двойню высокий, и тогда и выше риски невынашивания или преждевременных родов. На самом деле женщина, которая идет на суррогатное материнство, она здоровая женщина, которая имеет хороший анамнез родов своих детей, поэтому риски для суррогатной мамы существуют, как, в общем-то, всегда существуют при беременности. Но мы считаем, что беременность – это не болезнь, и здоровая женщина рожает здоровых детей.
Well, of course, there are certain risks, but they do not differ from the risk of any ordinary physiological pregnancy achieved by natural conception. But still, very often in IVF programs we have twins because we transfer more than, two fetal pregnancy, it's called medical term, because we transfer more than one embryo, and of course this is, the risk is higher because this is blood pressure and all other related risks with the pregnancy when the woman carries twins, and there is higher risk of miscarriage. But still we have to understand that before the woman is thoroughly medically checked and we take into this program absolutely healthy women, so this risk is much less than the risk if the woman just carries her child for herself and she's, for example, after 50 or after 40. In this case, we have healthy women in a reproductive age. We do not want to continue personal relationship with our surrogate after the birth of our child. How can we be kind to her but still stay slightly distant? Okay, I understand this is a psychological problem and not all couples can be absolutely psychologically prepared to be in constant contact with the surrogate because it maybe deepens their problem of infertility, especially for a woman, for intended mother who cannot carry a child on her own. And for this we provide you with the service that we contact surrogate on our own and forward you all the information we obtained from her. So you don't need to call her, to email her, to Skype her. We just speak like we were you, like we are intended parents waiting for the child, and we redirect all that information to you, so you have to be aware about all the issues, and we slightly explain surrogate, why is it so, and we even do that on the interview. We sometimes explain that infertile couple maybe would be not absolutely prepared to be in contact with her all the time, and they understand and agree with that. Because we really try to explain all these details before they are chosen as surrogates. Are surrogates usually married? Well, it depends. Usually, yes, they are married. Some of them are divorced, some of them are single, but all of them have at least one child, as I told. I wouldn't say that I prefer married surrogate over unmarried because there are different issues. Married surrogate has additional support by means of her husband, psychological support in routine daily life, some domestic affairs,